Hello, my name is Hilary Baldwin. I run the Acne Treatment and Research Center in Brooklyn, New York, all acne all the time. And I'm here tonight to talk a little bit about Absorica LD. You're probably familiar with isotretinoin in general, and this is the second permutation from conventional generic isotretinoin. The LD stands for low dose. And the reason why that name is attached to Absorica is because it's so well absorbed that we actually need to lower the dose by 20%. So whatever dose the patient is currently on of conventional isotretinoin, you would cut it by 20% to utilize this medication. That also includes your cumulative dose, cut by about 20%. Now, how is it that that happens? Well, that happens because this formulation is micronized. So the particles of isotretinoin within the capsule, tiny, tiny little particles. And as a result, the surface area of the particles is greatly increased, which greatly increases the ability of the pieces to be absorbed. 50% better absorption compared to the Absorica itself, and probably somewhere in the vicinity of 80 or 90% better absorbed than conventional generic isotretinoin. So this makes a big difference to our patients. Because it's micronized, because it's absorbed so well, it can be taken on a completely empty stomach. And that has a lot of implications. The first is that, as we well know, people don't eat breakfast. Isotretinoin is a BID drug. And that means that that morning pill, if you're using conventional generic isotretinoin, is falling on what I like to call a deaf stomach. It's not getting absorbed. You lose about 60% of absorption when you take isotretinoin on an empty stomach. With the LD formulation, you get complete absorption, even on a completely empty stomach. Now, this is an issue because about 66%, for example, of teenage girls don't eat breakfast. You add on to that all the people who are dieting and are getting up in the morning and eating, Special K with skim milk and raspberries. That might be breakfast, but it does us no good in isotretinoin land. And all of this adds up to the fact that with LD, the patient can take it at any time of day, completely empty stomach. They don't need to be consuming it with 50 grams of fat, which makes it the most common side effect of isotretinoin, obesity. They can take it twice a day because that morning pill is not falling on a deaf stomach. The micronized formulation is going to get absorbed regardless of stomach contents. This is also very useful in certain patient types, like people who are very heavy, who are trying to lose weight. Perhaps they're on a low-fat diet. Perhaps they're taking GLP-1s. Maybe they're even on a low-fat diet because they have high triglycerides or cholesterol. All of those patients cannot take isotretinoin on a 50-gram fat meal for various and sundry health reasons. So on occasion, LD will not go through on the first request to the insurance company, but upon appeal, I often refer to the patient being obese and needing to lose weight, high cholesterol or triglycerides, where telling them to take a pill on top of a 50-gram fat meal is unhealthy for them, and also patients on GLP-1s where absorption is decreased still further, and they really need the LD formulation. So as far as I'm concerned, this is a superior isotretinoin across the board for all of our patients, but is specifically important for those in whom a 50-gram fat meal twice a day is inappropriate.